Hi everyone, Dr. Emmy from Pain Free and Fit. Today we're going to be going over biceps training and what you can do to avoid pain and aggravation to your lower back herniated, degenerative, and bulging discs. Hope you enjoy. So disc herniations are chronically irritated by having the spine move out of its neutral position. With biceps training, that can happen a number of different ways. Many times the back portion of the disc where the herniation is aggravated with extension, too much leaning back because it pinches the herniation or bulge. So in an exercise like a barbell or dumbbell curl standing, when you're trying to eke out those last few reps, you'll have a tendency to lean the upper body backwards or throw the hips forward. Doesn't have to be a big motion. Sometimes it's just a little bit of a help with momentum to complete that rep that winds up traumatizing that disc. So an option for this is to use a split stance where one leg is back as a post and it artificially helps hold you in an upright position. Remember, when you have a split stance, you're a lot more stable front to back than you are with the legs together. Another alternative is to use dumbbells for your curls, either standing with the legs together, one arm at a time, or alternating curls, especially using a split stance. One arm at a time, it's a lot easier to control the motion and prevent that extension from going back and pinching that disc herniation. Now conversely, if your disc herniation is irritated with lateral flexion, so for instance, let's say I have a bulge or a herniation on my right side, and I find that leaning into that side or hip hiking, raising the hip up on that side aggravates symptoms, that you're going to have to be careful of, because when you're using a dumbbell one at a time, you're going to have much more of a tendency to lean into that side to complete the rep. So in that case, you may be better off using a barbell where you're stabilized to avoid that lateral flexion. Now, seated curls many times are going to aggravate disc problems because when we sit, we place 12 to 13 times the amount of vertical compression on the disc versus standing. So even if you're holding a nice arch in your back and you're performing dumbbell curls, many times just that seated position with weight, when it comes up, there's a vertical component on your disc, it's going to irritate it. Same thing with preacher curls. If I'm leaning forward over a preacher bench, most of the time my lower back is going to go into a position of flexion, meaning I'm going to lose that arch as I complete those motions. And after I get done with that, or as I'm trying to eke out those last few and my body has a momentum of going forward and back, many times that's going to irritate my disc, so I have to watch out for that. Now, one of the nice options to totally decrease the compressive effect on discs is to use chins and pull-ups for your biceps work. Many times while chinning, because your body is suspended in the air, the disc is free, there's no compression on it. And there's a few techniques that'll help you with this. Number one, when we chin, if we keep our elbows more forward and we prevent the typical lat involvement of bringing the elbows back, as we chin and keep the elbows forward, you're going to notice it's a great way to target and dominate the biceps and decrease lat involvement. As our elbows come back, our lats will also be engaged, and it's okay because our biceps are also working as a secondary mechanism, but if we want to try to isolate the biceps more, we can just use that motion. Now, if you do it next to a wall, you have a chin-up bar next to a wall to prevent that motion from happening, great. But if not, you can practice with light weight on a pull-down machine, especially standing so you don't compress your disc, and just get used to making this chin motion with your elbows forward. And eventually, you can bring it up onto a bar, either with your feet up on a box to help you at the beginning and then eliminate the box so you get that pure elbows forward chin, which would be great for biceps. Again, changing your grip, you can emphasize brachioradialis and brachialis with forward type pull downs, but this is a great way to really get the biceps. Now keep in mind, when you're chinning, the typical mistake is that many people make is they allow their hips to move forward too much. You know, typically we are much stronger on our lats when we're doing a row motion, which is a front to back motion, than we are with a pull-up or chin motion, which is a top-to-down vertical motion. So what happens is while we're doing chins, although we start out in a strict form, as the reps get difficult and we try to finish the set, many times you'll notice the hips start swinging forward because in that position of hips forward, the arms now are more in a row position. So we're trying to just use normal leverage and mechanics to help complete it. Unfortunately, when our hips go forward, many times we lose the arch in the back. When you're vertical and chinning, that arch is going to be a lot easier to maintain. When you are moving the hips forward, you'll notice that arch. If you just put your hand there in a standing position, you'll notice as the hips come forward, that arch decreases, and that compresses the front of the disc, which many times pushes that nuclear material, the nucleus of the disc, backwards into the herniation, especially if it's a common herniation, which is a posterior backwards type herniation. So making sure that as you complete your repetitions, whether your elbows are forward or whether you're doing a full chin, you try to keep the hips back, or if the hips do move forward, you want to make sure that you tilt your pelvis with that so that your tailbone is moving up and your pubic bone is moving down. That's an anterior pelvic tilt. So you may even want to set that before you get to those last few reps so that you're just maintaining that as you complete your set. Remember, if you're looking for a great program to figure out how to analyze your lower back for its mechanics, for its posture and stability issues, how to protect your spine, check out our Fast Track program for degenerative disc disease. It applies also to herniated and bulging discs. It'll take you step by step in terms of analyzing your body, figuring out where your spinal stability issues are, how to correct them and your muscle imbalances to support your spine in a nice, safe, neutral spine position that's unique for you. And it'll take you also through the necessary exercises to build a program that's not going to hurt your lower back but keep you in great fitness. I hope you've enjoyed this video on lower back pain, disc herniation, and biceps training, and I hope it helps you prevent lower back pain with your fitness pursuits.